Hey everyone, it's Dr. Rick. Today's tutorial is on brain fog. I should have made this a minute clinic, but it might extend a little bit. George had reached out to me saying that in this season he's having issues more than usual. And brain fog, I usually hear that. In layman's terms, it's just a point of confusion. Difficulty with comprehension, with problem solving, with getting along, with doing the usual things because the brain just doesn't process as fast as it usually does. The question was sent to me, I think Thanksgiving, the day after Thanksgiving, Friday, and I was in brain fog. We hosted a Thanksgiving party in my house, and as most of you know, I don't drink alcohol. I am a vegan and a pet owner. Fat boy. And yet for a holiday, especially if I'm going to host, I would probably break some of the tradition I had. So I did break the tradition. And me and Perry had, Jose brought this stuff. I always see it on the music videos, Cristal, and there was 2 bottles and we only finished 1. And I don't really drink champagne that often, but I had 1 glass, and then a beer, and then chips. So, I think that's fine every once in a while, but it brought me back to why I avoid that stuff. Because Friday morning I was just, so I usually wake up at like 4:30, 5 o'clock. I answer some portal messages, emails, think about studying whatever topic I'm lacking or interested in. And then I get on with the day, usually exercise. I couldn't do anything Friday morning because of probably the poor sleep, the alcohol side effects, and the chip side effects. So there's a combination of different things, but George, or anybody that's watching, the idea with brain fog is that if you're not optimized with your sleep, with your medical conditions, with your nutrition, and with your activities, then it's going to be hard to do the things you usually do if you work or if you're a student or if you're a parent. And those are all challenging. They're all challenging things within those 3 realms that push our need for good sleep and proper nutrition and exercise to the limit. So when you're on the fence, especially if you add a little sprinkle of age, like 50 to 60 years of age, it'll put you off the fence, and then you'll be symptomatic. And when you're symptomatic, then your brain actually starts tinkering and thinking, is there something wrong? Do I have a tumor? If I throw a little bit of a headache on, or numbness and tingling, or blurred vision, do I have MS? So I think a lot of things will surface, when in actuality, there's the majority of reasons for brain fog, poor memory, difficulty with processing, problem solving is usually because of things that you are in control of, such as sleep, quality of sleep, nutrition, whole food, maybe mostly plant-based, but at least healthy, and then exercise. So if you don't do those 2 things because you don't have enough time, understood, I've been there, and I see my other patients that don't have enough time, but that is exactly why I do 15 minutes 3 days a week only as far as my exercise. And then maybe if I can squeeze in 60 minutes on the weekend, which is Saturday now, and I haven't worked out, but I'm dying to do it. I just don't have any time. Maybe tomorrow, yoga class or something. But, so the setback is during times of revelry and celebration, it's okay, but not on a regular basis. This is my arch enemy. Not pitas, I don't really like these. These were just for the party. I have problem with potato chips, especially Lay's. If I have a family-sized bag of Lay's, whether it's the wavy ones or the flat ones, you give me a good Netflix movie or a Blu-ray, a Marvel movie, I will finish the whole bag within 2 hours, and then I'll be guilty and have a flare-up of my IBS. So that's my poison. I think anybody that watches my videos will understand that. I don't really eat sugar anymore, but this is brown sugar, and don't be fooled. Brown sugar is just as bad as white sugar. It might have been less processed, but it's still bad because it incites insulin response, and insulin is not good. It also turns on those things that like mTOR and PKA, which I don't have to get into, but check out my videos on FMD because I love FMD so much. So all that will make the brain process slower. Even if you're a straight A student or you're a MBA or you're a CEO, you will still be challenged. You probably have very good coping skills and your rhythm, your algorithms are memorized as best as possible. You are going to trash them eventually. You're going down the wrong road with this stuff. So I really say that you should limit that. And certainly if my guys are stressed out, I've talked about the use of medical marijuana. This is, I can't see it, but that's rhythm, I forget what it is, at 1-to-1, which can be useful for sleep as far as my 50 to 60 year olds, and a lot of my 50 to 60 year olds like the edibles. This is a tincture, but this can also backfire because that's the other thing is if you have a subclinical or on the fence behavioral disorder, say anxiety or depression, and you push the envelope, you don't take care of it, eventually it'll fall off the rails and you will have a full-blown either moderate to severe episode of either of the two, anxiety or depression. And that will put you into brain fog. So the anxiety part puts you at a heightened response day and night. Even if you can say that you get to sleep, you crash and you're exhausted and you sleep from 12 or 11 to 6, I will always challenge my patients because the majority of Americans say that they don't get good sleep or they think they get good sleep, and then I ask, well, how many cups of coffee do you have? 3. That usually means you didn't get good sleep. Why else would you need a stimulant? It's not the taste, it's not the upset stomach and reflux. So, I mean, those are rational decisions for having coffee, but with one of the #1 prescriptions and over-the-counter medicines being Pepcid, Prilosec, omeprazole, I really think that we're pushing the envelope with upset stomach and reflux and at the price of liking coffee. But it is a stimulant and it does get us by. And certainly when I was in college and going through med school, my daughter probably feels this in vet school, you have to study. My son's already planning for MIT, he's only a sophomore, but he has to study. I'm not gonna have him drink coffee, but the majority of adults out there will probably imbibe in coffee just to stay awake. And then what happens is because you can't sleep because you had coffee earlier in the day, you'll imbibe in alcohol to go to sleep. And then the next day you'll be so tired from the alcohol, you'll need more coffee. This is a really backwards way. And then with the coffee, you'll have to, because you can't sleep, you have to eat something because the cravings and the poor sleep have told the brain not to make any dopamine. You'll seek out the dopamine in the form of foods. So that's my last point here is you really have to, especially if you have a sleeping partner that isn't on the same page, you'll have to put everything that's important for getting a good night's sleep on. That would be eye mask, cold temperature, blacked out, even if you wear an eye mask, blacked out room, earplugs, nice comfy, oops, sorry buddy, it's nice comfy sheets, and then usually I think that the delta, or the change in temperature from warm to cold also initiates that hibernation reflex. So right before you go to sleep, if you take a shower, it would be good. So I think that the change in temperature for me initiates that dive, slow pulse, slow brainwave. My 4-7-8 breathing, I'll put that down below in case you can't sleep, and then bingo. For times when I can't sleep, CBD. So yes, there are. That's what I would say first is that during this time of winter in Chicago or Florida, you're going to have the challenges that will bring out some problems with brain fog, mostly because of things that we can prevent. I don't have a problem with Halloween, Thanksgiving, Christmas, or Hanukkah, and New Year's, but aside from those 4 holidays, you shouldn't have too much more. Maybe a office party, but you shouldn't have too much more. That's still 4 months. 4 holidays, that's once a month, but yet we seem to extend it. I went to the mall to pick up some tea at the outlet, Premium Outlet, after I took a test today. And there, I pulled into the side parking lot, the entranceway, and it said lot full. I'm thinking, I just want tea. So I parked way down into another shopping center and walked the distance. And as I was walking the 4 blocks, which is nothing, I saw the same car circling around over and over again. I said, just park over there. But anyway, I would say that the season is high stress now, which again forces us to do more things, stay on the road, be more stressed out. There's also seasonal affective disorder. All these things I think are preventable in so many ways. Seasonal affective disorder, you certainly can't bring out the sun earlier, but you can prepare for this time of year of stress by really diving into meditative practice, calming practice, twice a day breath exercise, seeing your counselor. I highly suggest a psychologist, cognitive behavioral therapy, or going to your church or temple and joining in group therapy. I think that you're not the only one, but if you let it go because you think you can get by, eventually it's going to tip over where it does surface and become uncontrolled. And then we have to think, if I get a portal message or an email or a text saying, I'm really in big trouble, and I've had a couple, then I have to wonder, okay, is this a medical emergency? To the emergency room. And I guarantee you my colleagues in the emergency room will either think they're going to put you in a hospital for expensive procedures, expensive tests, expensive medicines, or they're going to send you back home with the same treatment of what we would have done, nothing at all. And then come see me, which I am booked up until the middle to the late part of January. So, like every other doctor, see, this is the bad time of year. And if there is medical disease, all right, we'll address that now. So there are some medical diseases that present as brain fog. I think leaky gut, going from alternative to true medicine, Western medicine diagnoses. Leaky gut, I think, really sets people up because this is a time of feasting. And with feasting and leaky gut, technically you'll have more crap get in you to give you crappy thoughts. And that's why I try to stay vegetarian, vegan. That indulgence that I did Thanksgiving in my own house, I was able to control the food. I had tofu, which unfortunately I could taste the sauce. It had a little bit of sugar in it, and it's from a local Chinese restaurant. But every other dish in my house was meat-based, so I chose to just do that. But the problem, again, is the alcohol. No matter what kind of alcohol, except for hard liquor, which I don't do, usually is sugar-based. Alcohol sugars are bad for you. They still bring on the same response in either 6 hours, 24 hours. So those of you who drink alcohol and you think you can handle it, it does make you tired at first, but usually the half-life of alcohol is about 6 hours. So if you have something at 8, 9, 10, you will get sleepy, a little bit relaxed, but about 2 to 3, you will probably start to come out of your slumber because it's either made you pee and you've accumulated bladder urine and you have to empty, or it just brings that dullness out and then you're back to where you were right before, high stress. And that's not good to wake up with high stress or have high stress that wakes you up out of a deep sleep. So then you just broke your sleep. So that's why I don't like sugar. And sugar is in coffee too. If you go to Starbucks, it's in foods. You have to be careful. Read labels. And I did just do a label reading video somewhere. I'll try to post my links down below. Hey, this is the first time you're finding me. Don't forget to hit the subscribe button and the alert button to find out when I do new videos too for the season. So leaky gut, there's ways to take care of leaky gut. Obviously, the first thing is don't indulge. And the second thing is heal and seal the gut. Probiotic after you've established with something of a barrier, say something high mucilage like marshmallow root, slippery elm, DGL. I believe I have a video on that, and I'll try to put it down below. So if leaky gut is taken care of, cool. Then we have the true things like thyroid disease. Thyroid disease, if your thyroid is off, which usually it doesn't really hit you suddenly, it's slow and steady, it's insidious. So I don't think thyroid disease is the last minute urgency, even if it was, or I should say, even if the blood tests show that there's a thyroid problem that's out of balance, it will take months to fix that. So other things like B12 deficiency, iron deficiency, maybe, I don't think a cholesterol issue would really come on like gangbusters. Atrial fibrillation might present unusually. I had one patient that was a little, she was having some palpitations, came to the office, a little bit tired, but bingo, she was AFib. However, we didn't know how long. I got my cardiologist on the phone. We started on Xarelto, and I think she has an appointment next week. Not good to be AFib. Other things, multiple sclerosis, brain tumor, likelihood is low. Infectious diseases, maybe a sinus infection in case you have a stuffy nose and you can't sleep, maybe. The increase in weight gain, even if it's 3 to 5 pounds, it can make you come over the edge as far as a snoring or apnea issue. It's best to ask your spouse or your loved one if you are snoring, or if you are snoring and you stop breathing, you gotta ask for a pulmonary referral for a sleep specialist or a neurology specialist. They both do sleep studies. But that's something you have to schedule, and that also takes time. Once you get a CPAP machine, life is good, but it takes time to come up with the diagnosis, the consult, and then the machine. So that doesn't happen that fast. Probably faster than thyroid disease. Diabetes, sudden? Probably not. Even if you are a pre-diabetic, or if you're what I find is insulin resistant, the likelihood of having that suddenly get worse, low. You'd have other symptoms. Chronic peeing, insatiable appetite, constantly thirsty. Those all could be an issue. Chest pain, blurred vision, headache, maybe. The deficiencies, probably not a big deal. As I mentioned, magnesium, iron, or B12, those aren't fast diseases, they're all slow diseases. So short of that, I don't think the other diseases that usually show up at the office will really present as suddenly giving you brain fog. Now, if brain fog is associated with headache, associated with numbness and tingling, maybe. The final things as far as Western medical diagnoses, which nobody's going to want to hear, yes, anxiety and depression. I touched on that earlier, but it's a tough sell to get people to buy into that. I don't know why. I mean, I used Zoloft when I was at Central DuPage Hospital for a short time when I was inundated with stress. It's normal to have depression, and if you think you're too good for depression diagnosis, you're going to have every other symptom that pops up before you come up with a diagnosis of depression. Behavioral disorders usually, if unaddressed, will manifest as a whole bunch of medical disease or symptoms. The typical thing is anxiety, especially medical anxiety. People with a lot of anxiety, especially the ones that are self-medicating with medical cannabis, whether it's smoking, edibles, or vaping, that's cool. That's natural. I think that's more tolerated than Xanax and less addictive than Xanax. But if you don't take care of the true reason for the issues, you will have a blossoming of disease, whether it's a panic attack, PTSD, or it's manifesting one medical symptom after the next. I had a couple people that stick out in my mind back in Central DuPage Hospital and here in Bartlett, that I have them come in the first time. Weird symptoms, a whole bunch of weird things, nothing's positive. And then I have them come in again. And then usually the symptoms escalate, and they're totally different. First it's the cardiovascular system, palpitations. Then it's the digestive system, upset stomach, chest pain, diarrhea. Then it's the neurological system, numbness, tingling, blurred vision. It's one thing after the next. Then it's thoughts and brain fog. But you'll see it ramp up. I would still say you have to get the alternative medicine diagnoses out of the way, the big diagnoses out of the way, heart, brain, other end organs, and then I have to entertain, or we have to entertain the treatment plan, which is usually going to be a psychiatrist and a counselor and a medicine or two. There's nothing wrong with medicines. I think I don't like medicines, but in urgency they do help. So it's a hammer. And prescription hammers, I think, are necessary sometimes, at least to reverse and bring it back in, reel the disease and the symptoms back in. Then when you have control, then you can let go of the medicines as long as the cause of the disease is taken care of. But that's the same thing as going totally natural. I have people that won't touch a medicine, they'll use muscle testing, which I think in the right hands, manual muscle testing is excellent. That's when you hold a product up and you do a muscle test to see if you're resistant to the product or strong against the product. And if you're resistant, you probably shouldn't have that product. If you're strong, it's probably okay. So, and in the hands of the right clinician, it's probably strong. But if there are multiple medical problems, that's just as bad as using too much of the big hammer of prescription medicines. I call it the screwdriver of the opposite end. If you have nothing but a screwdriver and you use a whole bunch of unproven or minimally proven evidence-based approaches, if your disease is accelerating or it's plateauing or it's improving, but no, not improving, it's getting worse, then you really should get off of the screwdriver, at least the very conservative alternative medicine approaches. And if your disease is not that bad, you probably shouldn't use big hammers of prescription medicine. So it's up to your clinician or primary care doctor, hopefully an integrated medicine doctor, to kind of vacillate between and kind of come up with your plan. That's what I love about alternative medicine or integrative medicine. The problem is insurance-based medicine allows me 15 minutes. There's no way I can do all that stuff in 15 minutes. The usual reflex in 15 minutes is to give a prescription. And I've seen some really good chiropractors. Usual reflex in chiropractics is to give a manipulation and out the door. So even acupuncture, traditional Chinese medicine is a whole system acupuncture, but a whole system approach. But if you just do the needling and you don't do the calming practice, the exercise, the Tai Chi, the Qigong, the eating of the right foods, you're doing just half of the stuff. Even in Ayurveda, if you're just doing yoga and not doing anything else with the eating, the meditative practice, the think like a yogi, you're just doing half the stuff. You're half-assed doing it. So I think there's benefits to either end of the spectrum. But bottom line for this season is when there's brain fog, have no fear. The likelihood of disease is very low. Honestly, if we're in the United States, I think one of the best things that you can count on is if there is a trauma of some sort, car accident, massive disease, it's worth it because we have great surgeons and we have postponed damage. But aside from that, preventive medicine, probably futile because we just don't have the time in Western medicine. And the alternative medicine guys probably don't have the training that is strong enough to apply an evidence-based approach. There's a handful of doctors in the alternative medicine field that are very good, but I think it's a cooperative effect of how to take care of my patients and the best bang for the buck, to find direction and stick to that direction no matter what happens. And sometimes it has to be reassessed. So hopefully this gives you a little bit of an idea on what brain fog is like. So if you're having issues with difficulty with concentration, difficulty with problem solving, very emotional, can't get to sleep, your thoughts are wild or your thoughts are just blunted, not there, if those are symptoms of brain fog, I think it's essentially difficulty with memory. And caution to my guys that use cannabis, medical cannabis. This can also take care of brain fog, not this in particular, but medical cannabis in particular, can take care of brain fog initially, but it might, if you don't take care of it, the reason, it'll worsen the brain fog. So be careful and get your prescription from a good doc that knows what he's talking about. So hopefully this gives you a little bit of a foothold on what to do. Those of you who are doing fine and you do know somebody who needs it, send this message to, or send this video to them. And otherwise, don't forget to subscribe. If you have any comments on how you taking care of brain fog or the diseases that were found when you complained to your doctor, your alternative medicine provider about your brain fog, please put them down below and I'll see you in the next tutorial. Right, Barry? Say goodbye. Happy holidays.